Welcome. Thank you for joining us for our Kids Count in Colorado 2025 data book presentation. I am Heather Tritton. I am the president and CEO of the Colorado Children's Campaign. I'm glad that you are here, and I'm going to be joined in our presentation by Maya Gould, who is our vice president of research and author of Kids Count in Colorado. So before we get started, I just want to do a little bit of housekeeping. The Colorado Children's Campaign has been the voice of children in policy and advocacy in the state for 40 years, and we leverage data, research, and relationships to unapologetically advocate for kids in our state. We're always fighting for a brighter, more equitable future for every child in Colorado. At the Children's Campaign, we focus our advocacy and research efforts on 4 areas: economic security, health, early childhood, and K-12 education. Data and research are the backbone of our work. We use data to inform our policy decisions while also analyzing and disseminating credible, high-quality data and research. Kids Count is the foundation of this work. It helps us identify trends and build strong arguments for legislation and budget changes that are critical for Colorado's kids. Kids Count is also an important tool for informing decisions and creating context for children's issues statewide. In a time when information is easy to access but often harder to trust, Kids Count serves as an important source of quality, non-biased information on children and families. Every year, legislators and policymakers also use this report to inform their bills and decisions. Nonprofits and community partners use this statewide and local data to inform their work and fundraising, and the media uses this report to inform their reporting and add more context to the issues they cover. Kids Count is a snapshot in time, and as we walk through this data today, it's important to recognize that we are in a time where things are changing quickly. We will talk about programs that rely on federal funds to reach and support children. While the ever-changing federal landscape will likely impact these programs, today we will focus on why these programs are important, who they serve in Colorado, and how they promote child well-being. Please know that we will be continually monitoring the federal situation, and there will be future communications, action alerts, and webinars that discuss these issues further. We hope the information here today will support your work, and we thank you for joining us in our commitment to ensuring every chance for every child in Colorado. We always like to thank our funders. We couldn't do this without them. Kids Count is a part of the National Annie E. Casey Foundation Kids Count project, which funds this in each state and releases its own national data books every year as well. We want to take a moment to thank our funders who generously support this essential report. The 2025 edition of Kids Count is made possible through the support of the Annie E. Casey Foundation, the Anschutz Foundation, the Elk-Mar Foundation, the J. and Rose Phillips Foundation of Colorado, and the Buell Foundation. All right, a quick level set here. Kids Count pulls together data from the best available public and administrative sources, and due to data collection and practices that lag, the data that you're going to see in this report, a lot of it is from 2023, which is the best and most recently available data. The Colorado Children's Campaign works regularly to update and track data as it becomes available, including updating the Kids Count Data Center on our website. So let's dive in. Let's start by answering the question, who are Colorado's kids? There are 1.2 million kids living in Colorado, making up about a fifth of our population. Almost a third of those children are under the age of 6. And whether those children live on the Eastern Plains, the Western Slope, or somewhere in between, each one of them deserves every opportunity to reach their full potential. Colorado's kids come from diverse backgrounds and have a variety of experiences, strengths, challenges, and needs. Among all Colorado kids in 2023, just under half of children are from communities of color, and a third of children are Hispanic. The map on the right shows both where children live in our state as well as the change in population between 2019 and 2023. The darker blue areas have higher child population rates. So children live all across the state, and some of our biggest populations are in the Front Range. As a whole, our state is seeing the child population declining. Between 2019 and 2023, Colorado's child population decreased by 28,000 kids. However, like everything we will talk about today, we see different stories in different parts of the state. 15 counties saw an increase in their child population, including Weld County, where the child population increased by 6,000 between 2019 and 2023. In addition to our child population declining, we are also seeing the birth rate declining from 61.6 births per every 1,000 women in 2013 to 50.7 births per 1,000 women in 2023. As the birth rate is going down, the actual number of births has only decreased slightly by less than 4,000 births since 2013. This tells us that we have more people in our state, each having fewer babies. So we still have a lot of babies to care for, which we'll talk about more in our early childhood section. But first, we're going to talk about economic security, and I'm going to hand this over to Maya.
When children have stable housing, enough to eat, and a happy home environment, they can just focus on being kids, which is what we want. And generally in Colorado, families are doing pretty well. Colorado has one of the lowest rates of childhood poverty in the nation and a relatively high family median income. But this year, we decided to dig in a little bit further to better understand what families have, what they need, and how well they're really able to make ends meet across our state. Like I mentioned, Colorado has a pretty high family median income of about $118,000 a year, which was well above the national median income of $95,000 a year. That said, there are great disparities across race. For example, American Indian and Alaska Native families had the lowest median income of about $56,000 a year, which was less than half of the state's median income. This year, we pulled in new data to help us better measure really how families are doing besides just looking at income. And what we saw is that we expect that nearly 30% of families with children experienced financial hardship in 2023. So while only 11% of children lived in poverty in 2023, we think that far more children were probably living in a household that was struggling to make ends meet. In 2023, about 1 in 9 children lived in poverty, which was roughly the same number as past years. For a family of 4, this meant that they were making $30,000 or less to be considered living in poverty. But there's a wide range in childhood poverty rates across counties. Douglas County had the lowest childhood poverty rate of about 3%, and Castilla County had the highest childhood poverty rate of 37%. But we know that there's a lot of families that are probably making more than $30,000 who are still struggling to make ends meet. So we decided to take a broader look at family income this year. What we're looking at here is the breakdown of children's household income by different percentages of the federal poverty level. The federal poverty level is known as 100% of FPL. So if we look at double the federal poverty level, or 200% of FPL, we see that 28% of children are living in a household at or below 200% of FPL. And for a family of 4, this means that they were making $60,000 or less, which is better than $30,000, but in certain communities, probably still not enough to make ends meet. Similar to the poverty level, we see a lot of variation across counties. Rural counties were more likely to have more kids living below double the federal poverty level. While on the other hand, counties like Boulder, Denver metro area counties, and the mountain regions tended to have higher incomes. That said, just looking at income doesn't tell us the whole story. We need to know what the cost of living is across the counties to understand how much families need and if they have enough to meet their basic needs. This year, a new tool helps us do just that. The United Ways of Colorado launched the ALICE tool, which describes the household survival budget, and that is the minimum amount a family needs to meet their basic needs by county. In 2023, the average Colorado family of 4 needed just over $93,000 a year to meet all of their basic needs. But this ranged by county. In Summit County, the most expensive county, a family of 4 needed about $126,000 a year, while in Bent County, the most affordable county, a family of 4 needed only $68,000 a year. Using this household survival budget, Alice calculates how many families meet the budget and how many families are living below the budget. And what it found was that about 28% of households with kids weren't making enough money to meet the household survival budget, so they're likely living in some type of financial hardship. We think these more specific looks at families are really important to give us a better understanding of the true scale of economic help that families in Colorado need, and to help us better target our help and our policies for families across the state. A pretty startling finding this year we had was about housing instability. We saw that the number of children experiencing homelessness really skyrocketed between 2023 and 2024. And while we're still trying to understand causes and solutions, we suspect that this rise is mainly due to struggles in affording housing and a lot of newcomer families coming to our state in the past year or two. The HUD point in time count is one of our best measures to look at children experiencing homelessness over time. It counts the number of children that were experiencing sheltered or unsheltered homelessness on a given day. And while not perfect, it does help us look at how trends are changing over time. And we saw this year that in just 1 year, the number of children who were experiencing sheltered or unsheltered homelessness doubled to about 4,700 kids in Colorado. So we decided to look at other data sets as well and saw pretty similar trends. The McKinney-Vento Homeless Education Program serves all public school students who have unstable housing, which includes children living in shelters or experiencing unsheltered homelessness, but also children that have unstable housing living in doubled-up arrangements with other family or friends, for example. So these data provide a more robust count of the true number of children who are probably experiencing homelessness. And what we saw is in the last school year, the number of children with unstable housing grew by about 28%, or roughly 5,000 kids. This rise likely means that we're getting better at identifying kids that need help after a little bit of a dip during the pandemic, but it also is probably telling us that there are more kids that need help. And so combined, these two data sets are really pointing to the need to help more kids find stable housing. Like we said, we're trying to really understand the true causes of this, but one of them we suspect is difficulty affording rent. And in Colorado, rent is going up. The average Colorado rent in Colorado jumped by about $5,000 in just 2 years. Moving on to children's health, kids in Colorado are blessed with many great opportunities to eat fresh food, get outside, and get moving. But this year flagged for us that we also have some work to do here when it comes to children's health. In 2024, Colorado ranked in the bottom half of the nation for children's health. We know that these rankings and this measure isn't necessarily a perfect description of how kids are doing in Colorado, but we do still see this as a call to do better for our kids. In 2023, 22% of babies were born to parents who didn't have prenatal care in their first trimester, which is known as early prenatal care. Prenatal care is covered by most insurance plans, including public health insurance, and is really essential for the good health of the parent and the baby. So we're actually a little stumped on this one. Why so many fewer people were using prenatal care in 2023 than the year prior? We do suspect that access could be a driving issue, but when you look at the utilization across different counties, it doesn't perfectly align with lack of access. So there's a lot of great research projects going on around the state, and we're really eager to learn more about why there's been a drop in access or use of prenatal care and how we can better help these expectant parents get the essential health care that they need both for themselves and for their babies. As these children age, there are also other important measures we use to understand their overall health. We've actually been seeing a lot more tooth decay among kids, despite most of them having access to dental care. And we know that oral health is linked to overall physical health, and so this is a really concerning and important data point for us. We also see that immunization rates are getting better since the pandemic, but they're still lower than they used to be. In fact, there's actually 9 small school districts that have immunization rates below 80%. And these communities are at a higher risk for outbreaks and diseases like measles, which we are starting to see across the United States. Another key measure of children's health in Colorado is the child death rate for preventable deaths. And so we're really grateful to see that this year teen suicide rates are lower than they were in 2016. They were about 18.1 deaths per 100,000 teens in 2016, and now we're at 14.6 deaths. And this is evidence of great progress that we've made to support youth, particularly post-pandemic. But this year, we're also seeing that causes of death for other causes remain higher than they were in 2016, including accidental overdoses, motor vehicle accidents, and homicides. And so this is something that's really important for us to keep an eye on. On a positive note, one of our biggest bright spots this year is that we saw that the public health insurance landscape is doing a great job at keeping kids insured. Over the past decade, Colorado has made a lot of great progress in reducing the uninsured rate of kids. In 2023, only 4% of Colorado kids were uninsured. While this is still close to about 50,000 kids, it's a pretty low rate nationwide, and we're pretty proud of that progress. One of the big reasons that the uninsured rate has decreased is because of public health insurance. So last year we talked a lot about the Medicaid unwind, which was a change in Medicaid policies after the end of the pandemic that resulted in a lot of kids seeming to lose coverage. And we weren't really sure where these kids went or if they still had health insurance. This year, what we see is that a lot of these kids probably moved up to CHIP, which is similar to Medicaid, a public health insurance program, but it covers kids with households that have slightly higher incomes. So we saw that CHIP had an increase of about 60,000 kids in the last fiscal year, and Medicaid had a decrease of about 60,000 kids in the last year, which tells us that when a lot of kids stopped using Medicaid, their families were able to enroll them in CHIP because that's what they were eligible for now. So this is hopeful news. That said, next year will be the first year that we truly have data without any pandemic era policies influencing where kids are covered. And so we'll really be able to get the best sense of where kids are settling in.
We know that the earliest years of a child's life are a critical time to support their growth and development. Their brains are growing quickly during this period, and the experiences, care, and support they get will impact them for the rest of their lives. We are lucky to live in a state that prioritizes our youngest children. Colorado has made great strides in recent years to improve access to childcare and other developmental supports. That said, we also know that families throughout Colorado are struggling to find high quality, affordable care for their children, a critical support that allows parents to work and children to thrive. Let's start by talking about where our youngest children are spending their time. This chart shows data from the Healthy eMoms survey, known now as the Baby and You survey. The survey asks parents in Colorado about the type of childcare they used when their baby was 1 and 3 years old. These data show that many families chose to keep their kids, especially infants and toddlers, at home with a parent or family member. We also see that as kids get older, they are more likely to be in a childcare center or preschool. It's important to flag here that the oldest children in this survey are 3, so they do not yet qualify for the state's universal preschool program, which we're going to talk about in a minute. 4 and 5 of these families were happy with their childcare arrangements. And these data are from before and during the pandemic. So we're curious about how this might affect parent choices. New and more recent data are showing similar trends, including a national study that found that 20% of families use relative care. This highlights the need to consider family, friend, and neighbor care more in measuring the demand for childcare and understanding the full system of childcare. It also tells us we need to think about how we can better support families who want to stay home with their young children through policies like family and prenatal leave. There are still a lot of families who prefer to use childcare centers or licensed childcare homes. These childcare providers play an essential role in helping families get to work and supporting children as they learn and grow. We believe that every family should have the childcare option they choose, meaning we need enough space and affordable prices. Accessibility and affordability remain a challenge in Colorado. We are growing our childcare capacity across all age groups. Between September 2023 and September 2024, Colorado childcare providers added about 4,000 new slots for children under 6 and 6,000 new slots for school-age children. But still, we only have enough slots to serve about 2/3 of all children under 6 who have all available working parents in the workforce. While not all families are looking for this care, this does point to a potential need to help families in finding the care they want. There is still a lot of work to do to ensure we have ample amounts of quality, affordable childcare. While many factors play into how, when, and where childcare capacity increases, we want to mention the key role the workforce plays in expanding and maintaining childcare slots. To keep and add new slots, it's critical that we support our workforce who are often underpaid. In 2022, 32% of our childcare workforce relied on public assistance. While our childcare capacity is increasing, we continue to see the cost of childcare increase. Colorado is one of the most expensive states for childcare, both in terms of the cost of care itself and in the percent of income families must spend on care. In 2023, Colorado was ranked the fourth least affordable state for center infant care. The national average cost of care is about $11,580. Colorado is more expensive across all age groups. A family making less than $81,000 needed to spend 24% of its income to send a baby to a childcare center in 2023. If they had both an infant and a toddler, it would have cost them 44% of their income. Of course, prices vary by local markets and counties. For example, childcare in Boulder is far more expensive than childcare in Baca County. As we continue to work to expand childcare capacity, we must address challenges around the cost of care. In Colorado, we have seen a large public commitment to our youngest children. Voters, the legislature, and the governor have all committed efforts and resources to programs that support our youngest children. Because of this, the state has seen expansions in preschool, early intervention, and Head Start. Colorado's universal preschool program was funded by voters through a 2020 ballot initiative. The program kicked off in the 2023-24 school year and provides 15 hours of free preschool to all 4-year-olds and 30 hours of preschool to those with qualifying risk factors. In its first year, the program served 68.7% of all 4-year-olds, half of which were from households with low incomes, and saved families an average of $6,100 throughout the year. Recently, Colorado was named 3rd in the country for preschool access, in part due to this new program. We've also seen an expansion in early intervention services. Early intervention supports families with children from birth to age 3 who have developmental delays or disabilities. Between 2021 and 2023, early intervention nearly doubled the number of kids who received a developmental evaluation. More screens also lead to more children getting the services they need. All right, let's move on and talk about the big kids. K-12 education is an area where we focus a lot of our time. We've seen some good news and some bad news in this area. Kids are making progress, but we need to be really honest about where we are and the work and investment that we need to make to truly invest in our school-age children. So just to set the stage, public schools had about 881,000 students in the 2024-25 school year, which is about 400 fewer students than they had the previous year. Nearly half, 45% of students are eligible for free and reduced lunch. We also see a large immigrant population. Our immigrant population in public schools nearly doubled from about 15,000 to 30,000 kids in just 1 year. The Children's Campaign uses results from the Colorado Measures of Academic Success, or CMAS assessment, to monitor changes in academic achievement. While this is not a perfect measure, it is the one we have, and it also allows us to look at trends over time. This year, we see that students are struggling to meet academic standards on the CMAS. Over half of all students did not meet or exceed expectations across language or math. A quick note, we have flipped this chart. In prior years, we showed the number of children who are meeting or exceeding standards. These numbers that you see are the number of kids who are not meeting academic standards in English, Spanish, and math. 56% of students did not meet expectations in English, and 66% of students didn't meet expectations in math. However, on a positive note, scores did continue to rise between this year and last year, but they still remain lower than they were pre-pandemic. And to be clear, reaching pre-pandemic levels for reading and math can't be our goal. Over half of our kids weren't meeting academic standards for their grades then, and that is not acceptable. While the previous slide showed academic outcomes for all Colorado kids, this one shows achievement for low-income students. These outcomes are particularly alarming. We're especially concerned about our students from homes with low incomes. 75% of these students didn't meet academic standards compared to 44% of their peers. This points to a clear need for better direct resources to our low-income students in school. This fall, a new school funding formula will go into place that will increase funding for schools that serve low-income kids, as well as those who serve English language learners and children with special needs. We believe this is a big step in the right direction, and while it will take several years to fully implement this formula, we look forward to continuing to build systems that provide needed support for all Colorado children. High school graduation rates continue to be a bright spot in our report. Graduation rates are steadily increasing to 84.2% in the 2023-24 school year. Of course, the overall picture is more complicated than just one number. Some groups of students are more likely to graduate than others. We are particularly concerned about the low graduation rates for kids in foster care. At 40%, they have the lowest graduation rate, considerably lower than kids who are experiencing homelessness. Another notable statistic on this chart is the graduation rate for economically disadvantaged or low-income students. At 76%, this population is below the rate for all students, but much higher than several other groups. In addition to seeing improvement in graduation rates, we are also seeing that attendance is improving. Kids need to be in school if they are going to graduate and move on to success in life. So we are excited to see lower rates of chronic absenteeism. Kids are considered chronically absent if they miss 10% of school days or more. We're inching down to our pre-pandemic levels here, in part due to big efforts by schools to get kids in school. This is a big win. In 9th grade, attendance is a better predictor of graduation than test scores. So what do we do with all of this information? At the campaign, we use this as the background for developing our legislative agenda, identifying where we need to do better and how we can help. As we move forward, we will be using this data to help inform our legislative agenda for 2026. We are really looking at how we can work to improve access to childcare. We're going to continue to push for funding and changes that improve our K-12 system. We want to ensure that all of our children have access to healthcare that meets their needs. And really identifying some solutions to child homelessness, which we see a big increase in this report. And then finally, looking for strategies and solutions that allow families to access affordable housing and economic supports. We will also use this report to inform our responses to federal changes. While the Children's Campaign has traditionally been focused on state-level policy, we see that efforts at the federal level have the potential to reverse many of the positive trends we've seen here over the past few years. For instance, we want to make sure that we're protecting our child care assistance programs. We have implemented continuous eligibility for Medicaid for children 0 to 3, which should kick in 2026. And that is at risk with federal cuts, as is our Cover All Coloradans program. There's still a lot of work to be done. We are also going to keep presenting these data and having these discussions. And really using this data to keep kids at the forefront of every decision maker's mind. And we want to keep learning more. This is only a start to a deeper understanding of how we can make Colorado a better place for kids and families. So as you dig into the report, we want to hear your thoughts, and we want to know how we can make this data even better and what policy solutions you can brainstorm and you may have.
If you want to learn more, there's a few different ways you can dig in further. The first is you can request a printed copy online, both in English and in Spanish. And those are really helpful just to have in front of you every day to look at how kids are doing. You can also schedule a presentation that will tailor to your group, your county, or your issues of interest to dive even further into more data that's in the book that we couldn't present necessarily today. There's also two other data sources you can look at online. We have a Kids Count Data Center, and we also have county data tables at the back of the book this year, which on the next page we'll give you a sneak peek of. So this year we've updated our county data tables to include more measures that might be more helpful and tailored to the needs that you're looking at, to really understand how kids are doing in Colorado. So if you're interested in digging further into your county or into any more statewide data, please don't hesitate to reach out. We'd be happy to talk through more about what's in this book or go help you hunt down some data that's not necessarily in our report this year.
We're also excited to share that this year's the Children's Campaign's 40th anniversary. And so we hope that you can join us on Wednesday, September 24th at the Hangar Club in Denver to celebrate our 40th anniversary. Tickets are available at coloradokids.org/40th-anniversary. And then finally, we wanted to make sure that you have our contact information. So this slide just shows all of our email addresses. Please reach out to us if you have thoughts, ideas, questions, anything. We want to be reacting to you as you are digesting all of this data. Then finally, thank you for joining us. We appreciate you taking time to watch our webinar. Have a great day.